Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is November 19, 2025. This video is on a JAMA article published online on November 9, 2025, titled Dash Pattern Groceries and the Effects on Blood Pressure, the GoFresh randomized clinical trial. It was accompanied by an editorial titled Medically Tailored Groceries for Blood Pressure Control, Promise, Progress, and the Need for Optimal Design. Black adults disproportionately affected by high blood pressure. The DASH diet, that is, dietary approaches to stop hypertension, reduces blood pressure. Food deserts hinder access to DASH foods. This is a randomized clinical trial conducted in Boston from August 2022 to September 2025. 180 black adults. Systolic blood pressure 120 to 149 millimeters of mercury and diastolic blood pressure less than 100 millimeters of mercury. Not on any antihypertensive therapy. There were two arms, 12 weeks, home-delivered DASH groceries, plus dietary counseling, versus self-directed shopping with $500 of stipends. What is the primary outcome? Change in office systolic blood pressure at 3 months. Secondary, diastolic blood pressure, body mass index, hemoglobin A1C, LDL cholesterol, and 24-hour urine sodium and potassium. What did they find? Systolic blood pressure at 3 months with the DASH diet, a 5.7 millimeter decrease in blood pressure versus 2.3 in the self-directed group, p-value 0.009. Diastolic blood pressure decreased by 2.4 millimeters in the DASH group. LDL cholesterol decreased by 8 milligrams per deciliter with the DASH diet. 24-hour urine sodium decreased by 545 milligrams. Limitation of the study, the effects were not sustained at 6 months. Modest potassium changes, less fruit juice allowed. Key takeaways: structured DASH grocery delivery and counseling significantly lowers blood pressure. Benefits disappear once intervention stops. The accompanying editorial talked about how the GoFresh trial shows home-delivered DASH groceries modestly reduce systolic blood pressure, diastolic blood pressure, and LDL cholesterol among black adults living in food deserts. Benefits were not sustained after intervention was stopped. Low-fat DASH design conflicts with stronger evidence for higher fat or plant protein DASH variants, example OmniHeart. The boxes included neutral foods, beef, poultry, and grains with that dilute benefit and increased program cost to about $1,125 a month. There was no rise in urinary potassium, limited adherence to minimally processed plant foods. The editorialists said the future program should target higher risk groups, use curated lists of underconsumed health-promoting foods, and prioritize Mediterranean style or unsaturated fat-rich DASH patterns. Clinical pearls, DASH-style groceries with counseling outperforms monetary support. Sodium reduction drives much of the blood pressure improvement. LDL cholesterol improvement aligns with reduced saturated fat. High adherence, greater than 94%, shows feasibility in food desert communities. Hit pause and read these eponyms at your leisure. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.